Hello everybody, Dr. Kevin Connors here. I'm here with Dr. Kelly Halderman. She's worked in our clinic, works as a researcher now, formulator, still helps us in many ways, good friend for quite a many years. We're going to talk about some new products that we have out, right?
Two in my hands. These are from Professional Health Products, and we had a collaboration with Connor's Clinic and created the 𝘿𝙧 Acute. There's a little bit of glare there, but 𝘿𝙧 Acute and 𝘿𝙧 Chronic. And then the third product is AI. So Dr. Connors, oh, you have it. Awesome. Can you tell us kind of why you developed this line?
Well, it was for Lyme patients, really. Now, can non-Lyme patients use this? Really for autoimmune patients, let's talk about that. But the first two products, the acute 𝘿𝙧 and the chronic 𝘿𝙧, really have Lyme patients in mind. So acute Lyme, so when we talk about Lyme, we really talk about three phases of Lyme. I know in the general public they call acute Lyme and chronic Lyme. That's why we named the products that, because most people know about that idea. But we talk about a third phase of Lyme, which is autoimmune Lyme, hence the name AI on this. So this can be used for anybody with any autoimmune case, not just Lyme. But when you're dealing with Lyme, you're dealing with a biotoxin. And typically, when we say the word Lyme, we're not just talking about Borrelia burgdorferi. We're talking about 100 different co-infections that go along with it. And people have a slew of those whenever they have a diagnosis of Lyme. So you're trying to kill this pathogen, right? So, and we always talk about in the acute phase, if you found out you just got bit by a deer tick and you got all these symptoms, you should go to a medical doctor and get an antibiotic. But you should also do things to boost your immune system. So taking the acute 𝘿𝙧, and certainly if I have an acute case of Lyme and I take an antibiotic, I'd actually take both of these because they're both immune stimulants. And this one is really, the acute 𝘿𝙧 is really created and designed for that acute infection. Certainly could take this for other infections like viruses that are going around and such too, but it was really designed for that acute bacterial infection. It's got the mushrooms, which are the polysaccharides. It's got berberine and cat's claw and great things like that that help kill infections. And then the chronic 𝘿𝙧 is for the more stubborn cases that have been going on for a longer period of time. And what it adds is some of the parasitic killers and some of the things that are gut binders and some enzymes to help break down the biofilm around these bacteria.
Yeah, I've never seen a product like this chronic 𝘿𝙧. I've never seen a product that has the comprehensive ingredients and then the proprietary enzyme blend in there. And like you're saying, the parasitic approach too. So this really, this is going to be a mainstay for people that I see, because I know that there's a lot that I'm grabbing so many different things, so many different products, and it's all in one, in that one right there. That's a great one.
Well, and that's a key thing, is you can have a great protocol for a patient, but if they have to take 10 different things, are they going to stick to it? And can they afford it? So when we designed this, when we talked about what we wanted in a perfect chronic Lyme protocol, it's like, can we get it all in one bottle? That was the challenge. But, we got the main things that we wanted in this product that would be for a chronic Lyme patient. And we are already seeing really good results with it. So it's exciting.
Awesome. And how about the AI?
Well, the AI is for that third phase of Lyme, and that we talk about. So if a person has chronic Lyme for a number of years, your body can start making antibodies to self-tissue. So why would it do that? Well, Lyme has the ability to hide inside of a cell. Once it goes intracellular, now my immune system can't kill it very well. Antibiotics can't kill it intracellular either. And over time, my body, my immune system, my B cells, my Th2 side of my immune system will start making antibodies against self-tissue. Once you do that, you have to be very careful, stimulate an immune response with any immune products like these. When you're in an autoimmune phase, you can't really use these or any other immune stimulating products. Well, how are you going to kill Lyme then? Well, you have to do it with things that aren't immune stimulators that are going to kill it directly. That's why we created this. So this has things in it that will decrease the inflammation around the where the Lyme is found, that will kill it directly, the enzyme blend that will help break up the biofilm around the Lyme, and will decrease that Th1 side of the immune system, decrease that killer side, so that you're not flaring this autoimmune reaction every time you're trying to kill something.
Very good.
So long story short, this is really and this could be used literally for anybody with any autoimmune condition. But for people that don't do well with immune stimulants, I have chronic Lyme, but if I take cat's claw, I get worse, then that's a sign that you need this product. And you need to calm down that killer side of the immune system while you're still killing the Lyme. It's going to take longer, but these people have already been in the game for a long time, and that's the product they need to use.
Right, and that's a big mistake that we see over and over again is people with these autoimmune conditions, they're on just a ton of immune stimulants, and they're helping their body. You taught me this long ago, that they're helping their body kill itself. And so this is a product, I've never seen a product like this put together. I'm so excited that we actually have this tool. There are so many people who are going about treating their autoimmune condition in the wrong way. A lot of even doctors and practitioners don't understand 3 phases of Lyme. So this is just kind of like a little preview, but we're going to do a longer educational series where we go in, Dr. Connors and I are going to go into the 3 phases of Lyme and talk about, really get into those for an educational piece. But these products are available at your store, right, Dr. Connors, right now?
They are in our store. You can go to our clinic site, Connors Clinic, CONNERS Clinic, and on the upper right-hand corner, or whatever it is, it says shop, our store, or whatever it says. And I mean, the key component, the key take home, if you're like, oh, well, how do I know what phase I'm in? Well, you know you're in acute phase if you just got bit, right? So then take the acute. Well, I'm in the chronic, but how do I know, if I'm not in autoimmune? Well, when you take immune stimulants, do you feel worse? Oh, I do. Well, then stop taking the immune stimulants, because every time you're stimulating your immune system, you have self-antibodies, you'll kill that which you have self-antibodies against, so you're killing yourself. So that's where you get on the AI and just start taking this. You will not hurt yourself with this, and it's going to take longer to kill it, but you're not going to kill yourself. So those are all available in our store. A lot of other doctors are carrying these products now, not just us. We're making it available to Lyme literate doctors everywhere through PHP.
Yeah, we've had a ton of sales. We've had a ton of practitioners know that you personally formulated these, and they're already on the shelves from California to North Carolina, all on the shelves. So we're excited that we were able to get in collaboration with Professional Health Products and Connors Clinic, and that we were able to bring these products because they're really revolutionary. And I think that, like you were saying, a lot of people are taking immune stimulants and making themselves worse. This is really a great strategy for that. So this is just the first of more educational videos that we'll be doing. But thank you, Dr. Connors, for your time. I'm really excited that these are out.
All right. Thanks so much.
Yeah.
Bye-bye.